Hello and welcome to the webinar. My name is Catherine Cavanaugh. I'm the Consumer Advocate with the National Healthcare for the Homeless Council, and I will be acting as the moderator for today's webinar, Effectiveness in Consumer Governance, a production of the National Healthcare for the Homeless Council with support from HRSA, Office of National Assistance and Special Populations. This session is being recorded. This is a 1-hour presentation with the last 10 minutes reserved for Q&A. To the bottom of the presentation slide, there is a chat box for participant questions and technical issues. Please type your questions or technical issues into the chat box at any time during the presentation. A selected number of questions will be answered at the end of the presentation during the Q&A session. The PowerPoint presentation and the recording of this webinar will be posted on our website, www.nhchc.org within 72 hours. For today's presentation, we have two wonderful ladies to share their knowledge and experience with us. Amy Grassette, a member of the Consumer Advisory Board at Community Health Link in Worcester, Massachusetts, who is the former chair of the National Healthcare for the Homeless Council's National Consumer Advisory Board, and Kristen Levy, who is the co-chair of the Consumer Advisory Board Committee at Albuquerque HCH Project. Unfortunately, Carmone was unable to join us today, but I'm sure she's sending her good vibes this way. For this conversation, Amy will be teaching us about the importance of engaging consumers in governance at their local Healthcare for the Homeless projects and how consumers' advisory boards can be effective tools for this engagement. We'll also be hearing recommendations for CABs from all of these ladies, as well as the real-life challenges and achievements from Albuquerque. At this time, I would like to pass the mic to the wonderful Miss Amy Grassette.
Thank you, Catherine. During this webinar, you will learn how a Consumer Advisory Board, or otherwise known as CAB, can enhance consumer involvement in governance and advocacy at HCH projects and in the community. Also, recommendations for CABs, as well as real-life challenges and achievements. Next. Federal governance requirements that affect Healthcare for the Homeless project, and this is in the Section 330 of the Public Health Service Act. The governing board at community health centers must be composed of a majority of individuals being served by the center, and that is at least 51%. Projects with some of their health center funds coming from the HCH grant must have one consumer with the experience of homelessness on the board. Projects that only receive HCH Health Center funding can apply for waivers to the consumer majority rule, but consumer participation in governance is still required. Next. Importance of consumers on advisory and governing boards. The only way to affect change in policy is to be part of the conversation. So ways to do that is help decision makers understand the needs of consumers from the consumer point of view. Advise HCH project performance and give input to decision makers for healthcare delivery and supportive services. Increase consumer confidence in making a difference, and keep governing boards focused on the needs of the special population that homeless and formerly homeless consumers represent. Next. Ways to facilitate consumer input. One of those ways is to include consumers or former consumers on the project's governing board. You can also conduct consumer satisfaction surveys or hold focus groups, but the best way to do this is to create a consumer advisory board. Okay? What is a CAB? A group of homeless or formerly homeless individuals, advocates, providers, and community members brought together to positively affect change at their local Healthcare for the Homeless project. And the purpose of a CAB? To advocate for consumers with respect to services at the HCH project, advise about issues that affect services and consumers at their project, assist consumers in navigating their way through service delivery systems and giving their feedback. And last, represent the consumer viewpoint in the community. Next. Here are some CAB activities. Under HCH services, or Healthcare for the Homeless services, reviews and recommends program services. Consumer feedback, solicit and communicate suggestions and grievances. Education and awareness, organize or speak at community events or forums. Policy, advocate through communities for rights of consumers. Participate in organizing events, and some of those are voter registration drives, Healthcare for the Homeless Day during Community Health Center Week, and Homeless Persons Memorial Day. Always remember that CABs do not make policy. Next. CAB Structure and Bylaws. I'm going to break this down into name and purpose of board, membership and terms, officers and responsibilities, meetings and committees, decision-making process. Next. Specifically, let's talk about membership. Important questions. Who's eligible for the CAB? How many members should be on the CAB? Your CAB should reflect the diversity in your HCH community. People who are currently and formerly homeless, people who currently or have used the clinic services. Be inclusive of all the project services. Next. Recruitment is one of the most important things a CAB or governing body does. And CABs are a great recruitment tool. Next. What's the difference between a governing and an advisory board? Governing board makes decisions, all the decisions. It includes professional experts, community stakeholders, and a sample of the population served. On the other hand, advisory boards. An advisory board offers recommendations to decision makers into how agency policies and practices affect those assessing services. Also a representative sample of the population served. Next. Governing board's activities. And this is a list of some of those activities. Approves the operating budget and scope of service, establishes and evaluates health center policies, monitors and evaluates health center activities, helps establish HCH project program priorities. Next. Representing other consumers. As a CAB member or member of the governing board, you are working on behalf of other consumers. Therefore, you must know what they are thinking or feeling. Talk to your customers and your consumers, rather, in the waiting room. Hold focus groups. Develop consumer surveys, or set up a feedback box where consumers can give input. Next. Consumer leader guidelines. Dues. These are very important things to know if you're going to be a consumer leader, whether that's in your local CAB or if it's nationally. Know the mission, goals, programs, and services of your project. Help your project to recognize its strengths, weaknesses, opportunities, and challenges. And those can be brought forward at CAB meetings. Get all the information before making a judgment. That's critical. Come to meetings prepared to participate. And sometimes that can be a challenge. We all know that this population is very transient, so one of the things that we do on a regular basis is recruitment. We want to have as many voices at the table as possible, and we want to engage the consumers at those meetings so that they're excited about things that we're working on. Sometimes consumer advisory boards can get stagnant, and I think it's important for consumers who have been on the CAB for a good amount of time to re-engage people and get them excited about the work that we're doing. Don't lose your sense of humor. That's really important. Everyone comes to the table with a different story and different things to offer, and it's important to let everyone have their say and try to use humor. It goes a long way. Don't speak for anyone else. Don't ask staff for favors. The staff is really there to support the Consumer Advisory Board, and we want to recognize that they are giving us that ability to meet and give feedback to the agency. So we want to overstep our lines. Don't hold grudges with other members based on voting. Next, leadership skills. It's important to have interpersonal skills. Communication and empathy are really key. I think that everyone that comes to a Consumer Advisory Board meeting certainly has a story of homelessness, although it's very different from their colleagues. So you have to keep an open mind and don't judge, and have empathy for people that are there with you. Motivation and encouragement. I think it's really important for us to encourage people to share their stories and to encourage them to get involved. In self-awareness. Creativity and analytical skills. Problem solving and critical thinking, being able to jump in when there's an issue and think on your feet, as they say, and try to resolve the issue so it doesn't become a bigger issue. Organizing projects and delegating tasks, whether you have a chair, a co-chair, or secretary, not all CABs work the same. I think it's important for everyone to share the work, and so that's one thing that we try to do is to delegate so everyone is involved. Decision-making and planning, and once again, everyone should have the opportunity to participate in the planning of activities and, of course, decision-making. Knowledge of the HCH project. You should know its mission, vision, and goals, and we touched on that before. Business management. It's good to have some of those skills as well. And strengths and needs assessment. I think it's really important to step back and assess what you're doing and make sure you're on target with the mission of the project and that you're not doing anything to hamper the ideas and the services. Next. Difficult conversations and conflict resolution. Disagreements will and should happen. And as I said before, we have a lot of different voices, a lot of different viewpoints that come to those Consumer Advisory Board meetings, and everyone should be able to voice their concerns, their viewpoints, whether or not you agree with that or not. It's really important for everyone's voices to be heard. Don't react, respond. And if it's something that you feel like needs to be addressed at a different time, say that. Respect others' opinions and feelings. Remember the goals, so get back to the reason of what you were talking about, and work to find common ground. So sometimes people just need to listen and be open-minded, and like I said work to find a common ground, so for the better of the group, move forward. Next. Advocacy. Advocacy gives people experiencing homelessness a voice. Advocacy represents the strategies devised, actions taken, and solutions proposed to influence decision-making in order to create positive change for people and their environment. And that's really what we're trying to accomplish by having a consumer advisory board, speaking for other consumers whose voices are not necessarily at the table, but we represent those voices in our communities who are going through homelessness as we did at one time. Next. Why is advocacy important? For lots of reasons, but some that I have here are changes community attitudes and misconceptions. As some of us are aware, there are a lot of misconceptions about homelessness, so I think it's critically important for us to change those mindsets and let people know that it can certainly happen to anyone. It holds service providers and systems accountable and ensures transparency in their actions, helps individuals and communities regain control, and it recognizes the rights of people, ensures people's voices will be heard. And that's very important. Some homeless individuals, including myself, didn't think our voices were important in the past, but I know that to be true. Promotes positive change to structures and policy. And I've seen that happen firsthand. It's a lot of work, but all these collective voices together can truly make a change. Next. Consumers are natural advocates because they bring real-life experience. And it validates, when you're telling your story, it validates your story and it gives you credibility. Very, very important. Describing your story and its relevance to what the issue is and raising awareness of the issue, whether it be lack of health care, affordable housing, earnable wages, any of those issues that affect not only homeless people, but all of us. And it educates our policymakers and the public. And that's what we need to continue to do. Next. Now, a little bit about the National Health Care for the Homeless Council. For those of you who don't know, the council was founded in 1989. It is a network of more than 10,000 doctors, nurses, social workers, clients, and advocates. And it produces leading research and highest level of training to more than 200 public health centers and health care for the homeless programs in all 50 states. In addition, we have regional trainings throughout the country, 2 to 3 a year. So you can go to the website, the council's website, to see when those regional trainings will be coming to your area. And we also have an annual conference where 800 to 1,000 people attend with an array of workshops and trainings for all. A great opportunity for networking. Next. The National Consumer Advisory Board, which is also known as NCAB. It's a standing committee of the National Health Care for the Homeless Council. It is open to health care for the homeless clients who have experienced homelessness or are currently homeless. NCAB organizes consumers at local health care for the homeless projects to have a voice in local and national issues. It helps others become more involved in their local cabs and serves as a clearinghouse of healthcare for the homeless information. If you do go to the Healthcare for the Homeless website, you can go to the consumer section of the website, and there are lots of resources there available from the consumer participation outreaches that we do, to Homeless Persons Memorial Day activities, and lots of other great information. Next. NCAB leadership positions. NCAB has a steering committee with 7 elected members, and that is a chair, 2 co-chairs, a secretary, and 3 members at large. When NCAB started more than 10 years ago, we did not have regional reps. We did not have members at large. We just had a chair, 2 co-chairs, and a secretary. So we have seen the National Consumer Advisory Board grow tremendously over the last 10 years. They are responsible for NCAB projects and work with the National Health Care for the Homeless committees. Members on the steering committee all serve on at least one council committee, whether that be education, policy, finance and personnel, and many others to choose from. Next. Other leadership positions that I spoke about a moment ago are regional representatives. Regional representatives have been in place for a few years now. We thought it would be important to have someone that could reach out in different areas of the country to other consumer advisory boards to engage them in the work that NCAB was doing, specifically the consumer participation outreach surveys that we do, so we could get a great sample of information across the country. We based this on HRSA's regional map, and HRSA has 10 regions in the country. We chose to cut that in half, and we have 5 regional reps. So as you can see by the map, the way that it breaks down, Region 9 and 10 would be 1 regional representative's area of coverage, which is quite large, but everyone's doing a fine job reaching out to other consumer advisory boards. Next. Some NCAB activities, be a collaborative voice on shared concerns of consumers across the country. We try to reach out to other like organizations and be involved with some of the work that they are doing that is very similar to the work that NCAB and the Council are doing, and have in the past collaborated with the Veterans Administration on a primary care survey, one of our consumer participation outreach surveys on violence was published a couple of years ago, where the steering committee members were all involved in coming up with that survey, administering the survey, tracking it, and then publishing an article in the Victims of Violence. We also support local events and sharing resources like Healthcare for the Homeless Day, voter registration drive, especially with an election coming up. We'll all be doing those sorts of activities. Walk for the homeless, and all sorts of other kinds of activities that benefit homeless people in your community. We also assist with trainings, webinars like this one, technical assistance, whether that be via email or a phone call to a project, or actually going to a Healthcare for the Homeless site to help with a consumer advisory board or to get a consumer advisory board started. Now I'm going to pass the mic to Kristen.
Thank you, Amy. Hi, everyone. This portion of the webinar highlights an agency that proves how successful consumer involvement in governance can be. What you see is a picture of the front door of Albuquerque Health Care for the Homeless. It was number 18 of the first 19 healthcare for the homeless to open in 1985. We started in an Airstream trailer in the courtyard of a day shelter. We have grown so much since then. The picture you see now is our campus, and all of our services are located in this building. We are also near the end of construction of a new building across the street from the one that you see. We have also become the largest homeless services provider in the state of New Mexico. For many years, we took the exemption waiver for cabs, but decided in 2006 that we would move towards a 51% consumer-based board, and we formed our CAB at that time. We also added 3 consumers to the board, myself being one of them, and during my tenure on the board, I served 2 terms as president of the board of directors, and in our agency's history, I am the only person who's experienced homelessness to serve in that position to date. I don't expect that to remain the case, however. And my absent co-presenter, Carmone, who you heard could not make it today, is a current member of our board of directors and sits on our CAB. And I do want to add that thanks to the amazing support of Albuquerque Health Care for the Homeless and all of the staff, that she and I will be starting our own homeless advocacy nonprofit, hopefully in the near future. So, in talking about Albuquerque Health Care for the Homeless, you see again the slide that shows structure and bylaws. And Amy talked a little bit about the things that you see on here. In Albuquerque, we do not have your average consumer advisory board. The name of our CAB is called the Client Board Advisory Committee, and it's a standing committee of the Albuquerque Health Care for the Homeless Board of Directors. So we're doing it a bit differently. We function in a different way as well, in that we have more than just advisory power. Anything that happens in Albuquerque at Healthcare for the Homeless, when governance or policy changes are made, it comes through the Client Board Advisory Committee, and we are able to yay or nay on moving forward with governance and policy changes. We participate and conduct a lot of activities in Albuquerque. You are seeing a couple of photos here. One is of a Healthcare for the Homeless Day that we did 2 or 3 years ago. And we had a little gathering outside, passed out ice cream, we had music, we had poetry. It was a really fun day. We, however, have realized that in August is one of the hottest times of the year here in Albuquerque, as we are in the desert, and that's our participation in HCH days is really difficult to do at that time of the year, so we do other things in other times of the year, and have decided not to do a HCH day anymore. But they're a fabulous way to get people involved and engage our consumers and educate on everything that HCH provides. And then the bottom picture shows our memorial wall. It is just a portion of the wall. Every year, we have our list of folks who have passed in the previous year, and we make tiles to commemorate their lives and put them on the wall in time for the Homeless Persons Memorial Day memorial service. And those activities start at the memorial wall at Albuquerque Health Care for the Homeless, and then we do a march of about 10 to 15 blocks to one of our large churches downtown, and that's where we have our memorial service. I have been honored that for the last 2 years, I've been the Master of Ceremonies for that memorial service, and it is an honor for all of us to participate, because we believe that it's very important that we honor those that we have lost in the last year. The reason we do the work that we do is to try to prevent those deaths. We also do in-house client surveys. We will be starting one next month that we will be doing for 2 months, and we are going to be doing it on trauma-informed care. And CBAC will be talking to folks in our courtyard and different programs, educating them on trauma-informed care, and then asking them if they have seen evidence of it in the work that we're doing with our clients. We also do a lot of client advocacy. And just as a note, here in Albuquerque, we say client rather than consumers. One of our biggest activities that we participate in every year is the lobby day in Santa Fe, our state capital, and we all go up and we run around our state capitol, which is called the Roundhouse, and chase down our representatives and advocate for health care bills and housing bills and anything that would make life better for the members of our homeless community. We are very much involved in site improvement decisions. In the last slide that showed our organization, all those beautiful trees that you saw in the courtyard, most of them did not exist in 2002 when I walked through the doors of Albuquerque Health Care for the Homeless as a homeless person. We were able to do a lot of additions to trees to provide more shade for our clients. And we also did a project a couple years back, and we were able to get new signage for our agency. We have a great sign out front that talks about all of our programs and where they're located. And every door in the agency has a wonderful sign in both Spanish and English to let people know where they are. The keys to success in Albuquerque have been the commitment to the work. Since our CAB organized in 2006, we have seen fluctuations in the amount of members we've had on our CAB. We did have some programs that were unfortunately cut a few years ago, some residential treatment programs and a PSR program. We used to be very successful in recruiting folks from those programs to sit on our consumer advisory board, but those programs closed, and so we've had to be more engaging with people in all of our programs. We provide lunch in our monthly meetings, and we often go out to the courtyard and invite people to come in and have some pizza and share their stories and listen to the work that we do and see if we can get them involved that way. One of the things that's really amazing about Albuquerque Health Care for the Homeless is the mutual respect that exists between staff, the board of directors, and the consumers involved in the governance of our agency. Our CAB has allowed our members to form really strong relationships. We have become very good friends, even if we don't always agree, and I think that connection has allowed us to be as strong as we are. We're very willing to share our stories, and we encourage others to do the same. And we always react with empathy and support when listening to other people's stories. We believe that one of the biggest keys to success is honesty, and that by being honest, even if it's something that may not be pleasant, we are making sure that the truth is told and that the voices of our consumers are heard. And we always promote open-mindedness because we believe in Albuquerque that part of our mission is to be aware of diversity and have inclusiveness in our agency. We decided in 2006 that we were going to go with the goal of 51% consumers. And when you think of that on the governing board at an HCH standalone clinic, it can be kind of mind-blowing. And it has been challenging. We have not yet reached that 51%, but we've gotten pretty close at 48%, and we are still working to bring it up to that 51%. It's a tough standard to compete with, but we believe that it is worth it. And so we encourage you all, and we do whatever we are able to do in order to meaningfully engage consumers to participate in the governance of our agency. And we have been very successful in doing that. And it is part of the reason why we have a new building going up, and we are able to expand our services and better treat our homeless folks here in Albuquerque.
I need an interpreter to medical.
Sorry about that. So I'm going to hand this back over to Catherine to talk about your CAB questions. Thank you.
Yes, thank you, ladies. At this time, we would love to take some CAB questions. I think we got a good overview of what consumer advisory boards are, some of the council work that is done to engage consumers nationally, and then a shining example of how it can be done on the ground at a local site from Albuquerque. However, at this time, I have no questions. So if you guys are wanting to know anything from Amy or from Kristen about their experiences with consumer advisory boards or on the national level where they are both involved, at the bottom of your presentation slide, there is a chat box for participation questions. So if you have a question, anything you would like to know from these wonderful women, if you just fill your question in there, and then we will make sure to spread that knowledge around. While we are waiting for something, I was just wondering, and maybe I could hear from Amy first, about how do you select people to participate in the CAB?
Oh, thanks, Catherine. Well, lots of times we get recommendations from case management. Case managers who work with clients on a regular basis and have noticed that they have strong voices, or they want to get involved, or they really have a unique story to tell. So that's one of the ways. Also, on HCH Day, when we have our health fair, we set up a table that is the CAB's table. And so we have information about not only the project, but how to join our CAB. We also put flyers in our waiting room, so trying to think of lots of different ways to get people engaged in the CAB. And it does take a lot of work. And we are, like I said before, constantly recruiting because people do fall out. We lost a couple of CAB members last month they both passed away. And so we're, like I said, we're actively looking for new consumers to join.
I think that also leads us to a good question when we're talking here about recruitment and how to get people involved. There was a question here that came from Deirdre on how do you handle inconsistent attendance at the CAB meetings when they seem to be a bit of a revolving door when people are coming in and out. I think Amy spoke to that earlier, so maybe this time we'll mix it up and we'll hear from Kristen.
Sure. You know, it can be inconsistent. We have been lucky here in Albuquerque that we do have a core group of very consistent members, about 3 or 4 folks that have been on this wonderful CAB ride since we started. And we do recognize that people have their own challenges, and that there are times when people are not able to participate. If people need to leave, we always let them know that they are welcome to come back when things settle down. and they get a little more stability in their life depending on, how things are going. So we find that it's very important to make sure that people know they're always welcome. And we also, as Amy said, we get recommendations from case managers, from therapists. Most of the time, they'll just send them to our meetings, but sometimes they will ask that one of us contact that person and give them information on what we do and how we do it, and how their participation can be very important. It's how I myself got involved on the recommendation of my case manager to participate in an open house we had for local politicians from the state and local level. I was a guide, and I showed people around, and the next thing you know, they're asking me to be on the board of directors, and the next thing you know, we're starting our CAB, and now, what is this, 7, 8 years later, 9 years later, we are we have a pretty good CAB going on. We have 7 members who have been consistent and make it regularly, and are excited to participate in the governance of our agency. And they participate in almost every activity that we do. And it's been a really great experience. So the best way to handle it is to just keep engaging new people, because you just never know when you are going to find that diamond in the rough that turns into an Amy or myself and becomes leaders not only in their agency but in their city.
And Catherine, can I just add as well, we have bylaws that our CAB created, and in our bylaws we have one section that talks about participation, and if you miss 3 meetings in a row without being in touch with someone, then we ask you to step down, but always, like Kristen said, let people know that they are welcome to come back when things are more settled.
So I would like to hear this from both of you, because I think we had talked about earlier in our slides, and I think this is a theme going on here about how important recruitment is for getting people engaged. So maybe just a couple quick characteristics that you think are important when you're looking for new folks. Like, what are some characteristics you guys look for in engaging new CAB members?
In Albuquerque, I think one of the things that we look for is interactive personality. I don't want to say necessarily outgoing, because that implies that, we don't look at shy folks, because we do. But I think that we're looking for people who, on site, it's kind of obvious that they engage folks and have conversations. We spend a good deal of time on campus ourselves, partly because we have Art Street, which is a public art studio attached to us. And so we're constantly engaging with consumers, and we are happy to listen to what they have to say. And, it's amazing the opportunities that pop up, whether you're in a courtyard or in one of your programs, the opportunities that present themselves to be, to talk to consumers about their experience and educate them on what we do. And when they hear what we do and how we do it, they get excited and their eyes light up, and they like to be involved. Now, they don't always stick around. Sometimes they'll show up to the first meeting and feel like it's not for them. But you just keep pushing forward, and you find really amazing folks in pretty amazing places. We also reach out to at events with consumers at other agencies and talk to them about what we do. To be on our board, you have to have experienced homelessness at some point as a consumer. To be on a CAB, we'd like you to have received services at some point from Albuquerque Health Care for the homeless. So we're always reaching out, not just in the agency, but in the city, to folks that can help with consumer governance.
And I think we look for both those kinds of people who we hear saying really wonderful things about the project and the service that they received to help them overcome homelessness or addiction or those other circumstances. But we also look for those people who have not had great experiences with receiving services because those are the people we need to fight for, and those are the people that need to lend their voice so that people that work within that agency know that sometimes things don't work. And sometimes that's when it dawns on people that you should be listening to the people whose services you provide. So I think it's really important, like Kristen said, to look in all different kinds of areas and situations where you might find a person that's excited about advocacy, or sometimes you just know. Sometimes you just get that feeling right away from a person that they have something they need to say, whether that's good or whether it's negative. But keep your mind open, for sure.
Thank you, ladies. We are getting some very interesting questions in now. So I have one for you guys. I think it kind of goes off of what you were just touching on, Amy, the idea that it's important to engage people that have maybe had negative experiences at the clinic, which I think can also go hand in hand with the idea that people experiencing homelessness often have competing interests for their time in trying to meet their basic needs, and we're wanting to get something out of them in their input, and maybe not providing anything on the back end to help support them. Do you guys provide any incentives for people to attend your meetings?
This is Kristen, and in Albuquerque, we provide lunch. So we always have pizza and salad. But as Amy was talking about, as far as the people who have complaints, one of the great things about our CAB is that it's staffed by our executive director 90% of the time. And if she's unable to be there, then we always have someone from our administrative staff staffing the meeting. And so administration hears directly from the consumer with both good and bad. And we've heard some bad stuff that has led to us to making major improvements in the agency and has let us know where things need to be worked on. We always want to be a model, and we want to make sure that we're doing the best that we can in service to our consumers. And one of the best ways to do that is to be willing to listen to the bad too. And it always gets directly to the top. And the great thing about that is that when someone comes to us with a complaint or a story about something that went wrong, they can often get answers right there on what will change, what they can do, and all of that stuff. And then if they need, we always let them know what our formal grievance process is. And then it's always, of course, really nice when we get the positive feedback from folks. We will often, after a change in the agency, just casually, non-scientifically, go around and ask folks what they think about it. And in the 13 years that I've been coming to this campus, since I was homeless, and then in the last 9, I have heard nothing but fantastic reviews of the changes that we have made here. So we just keep engaging folks.
As far as my project, we have a homeless program, and the homeless program also has a housing component of that program. And so at our meeting each month, the director of the homeless program as well as the housing director comes to our meetings. and they give us updates first about the whole project itself, whether that be staff changes or new funding opportunities or a HRSA site visit, as well as the housing director who talks to us about our housing program and if there's slots available and those sorts of things. And then we break into our CAB business. We often have guest people that come to our CAB meeting, not every month, but recently one of the nurses that worked at the project came to our meeting and taught us all us CAB members how to use Narcan, which is a drug to help people come out of an opiate overdose. And so now we are all certified to administer Narcan. And then as far as incentives, we meet once a month on the first Wednesday of the month at 4 o'clock in the afternoon. And so we also have a meal together, usually pizza and subs, and we go about our business. It's usually about an hour long. After you have attended consistently for 3 months, they do also give a $20 stipend that you receive towards the end of the month, which has been helpful to a lot of the CAB members. And then also they do have bus passes if people need that to get back and forth to the meetings.
And I'll add that we meet once a month on the third Friday of the month, but we meet during lunch. Our meeting goes from 11 to 12:30, and so to make sure that folks who want to attend get their midday meal, we serve lunch. And I'll tell you what, it's a great incentive when you're out in the courtyard and there's hungry folks, and we have no meal sites nearby, so saying, hey, come in and have some pizza and salad, that's a pretty good incentive. And it's amazing because they don't just come in to eat, they listen and they participate. We may or may not get them to join, but we certainly get feedback from them.
Thank you. And I heard something interesting. Both of you mentioned the involvement of staff in your CABs and your CBAC meetings. I'm just wondering if you can explain a little more about how staff is involved in the CABs, in their meetings, and then how they decide what they want to be doing. And if you feel that your consumer group is primarily client-run, how did it transition to becoming so client-focused?
Well, in Albuquerque, Jenny Metzler, who is our executive director, and staffs our meeting. Her main job is to take notes, but she is also there to give us updates on current projects, on current legislation, on national matters. And then, of course, if anybody has any questions about the agency or about the state of homelessness in Albuquerque, she's a walking encyclopedia. She can pull it up. She can answer pretty much anything that you ask her without having to go to a source. She keeps it all in that pretty head of hers. And it's been really amazing. And that goes for the other administrative staff that may fill in for her when she is unable to make it. They're all very knowledgeable, and not just about our agency, of course, but also about the city of Albuquerque and the state of New Mexico, and anything that even could potentially connect to homelessness.
As far as my CAB is concerned, the CAB I've been on the CAB for 11 years, and it was in place for probably at least 5 years before I came on board. It was always consumer focused, but staff, and typically it would have been the same two staff that we have now who participate. Their participation is giving us updates and asking for feedback that they then take back to staff. Also, letting us have space to hold our meeting, which we do in one of their boardrooms every month. They provide us with the meal, the bus passes, the stipend, as I talked about before. But, you know, if we need copies of things, printing out the agenda for the meetings, and those sort of administrative sorts of things that we need. And some of us don't have access to a computer, so it makes it difficult. So all those kinds of things. And they've been extremely supportive. We have gone through 3 different homeless program directors since I've been on the CAB, and I have to say that each of them were very involved. And we're in a really good place right now, although we've lost a couple of members. We have probably 10 members that have been coming consistently for some time now. So it's great to have that amount of people at the table.
It's wonderful to hear about all the support that you guys are getting. So I have one last question that I want to put out briefly here. It was a question that, what is the first step if the clinic does not have a CAB? How would you go about setting up a CAB? Very brief version of how you guys think a first step would look.
Amy, I'm going to let you take that first. Well, okay.
Here I am. I'm
okay.
here. Well, I think that the idea really comes from people, consumers who know each other and, you know, talk with each other on a regular basis and maybe have some ideas perhaps about how services could look different or could have looked different for them. And maybe, you know, have voiced that to a case manager or a therapist or someone along those lines. And then, you know, that case manager bringing that back to administration and saying, you know, we have this group of consumers who have been, you know, consistently talking to us about their concerns and the things that they like about what we do. Maybe we should get them together. Maybe we should hold a focus group. And that could be, you know, the first step in getting a group of people around the table is maybe having a focus group.
Yes, that's great. We do one focus group a year at least here. And then I'll add too, I think, you know, sometimes consumers don't know that they can do this. And if their agency doesn't have a CAB, they don't know that there's a possibility that they can participate in the governance of their agency. So I think that if you're a staff member and you realize it would be a really good idea to have that consumer involvement be more active, I would say talk to some of your consumers about it. Talk to your case managers and your therapists and have them talk to their consumers about it. Get an idea of, gauge the interest in the consumers in doing it, and see if you can't pull some folks together. I was very fortunate a couple of years ago. I did a technical visit to an agency in Colorado Springs that was an HCH grantee, and they were starting their CAB. And it was a really fabulous experience. Myself and our former consumer advocate on the council went to Colorado Springs. We had a day-long training and workshop with them. And so that's available for you folks across the country that don't have CABs. We can help you set your CABs up. And it was a really fantastic experience, and they were so grateful to have our assistance in setting up their CAB and learning what's expected of them, what they need to do, and how the best way it is to do it. So let the council know if you have questions, and we'll answer them for you.
Gosh, I didn't even have to set that up at all. That leads us perfectly into the resources page here. So if you guys want, we're just about up on our hour here. We hope you learned some and enjoyed your time. But if you have any more questions, if you go to the website for the council and go to the Consumer tab under Resources, you can learn more about NCAB, what NCAB does. We would like you to join so you can get updates. You can download the CAB manual where most of the information from this presentation came from, so you can learn more about CABs and how to engage consumers in governance. And as Kristen said, you can request technical assistance. So if you would like any of our assistance in helping you develop a CAB or address any issues you're having with your CAB, we can help you out there. Otherwise, I am Catherine Kavanaugh, the contact for the consumer advocate with the council, and so if you have any questions, I would love to help you as well. So with all of that said, I would like to thank you for joining us for Effectiveness in Consumer Governance, produced by the National Health Care for the Homeless Council. Hope you enjoyed your time, learned something that you can use in your everyday lives. This webinar will be archived on our website, www.nhchc.org, within 72 hours. And questions that we were not able to respond to will be addressed via email as soon as we are able. At the close of this webinar, you'll receive a link that will pop up. It's a survey to evaluate this webinar. We would ask you to please complete it so we're able to improve your webinar experience and provide good information. The only way we grow is through information. And a link to the archived webinar will be emailed to you as soon as it is posted on our website. So thank you for your time. Have a great day, and this meeting will now be closed.